So from the side, the arch, you see the arch curling up there? Okay, so if we keep that big toe down a little bit flatter, that's better. You can see the actual muscles contracting in there. You can see the pink bit sort of shortening up. Now, to make that exercise harder, we stand up and do it. Very complex, because there's more weight going through the area, therefore the muscles have to work harder to bring that arch up. And to make that a little bit harder again, we wear a pair of shoes. We tie the laces, so we're pushing against not only the body weight resistance, but the flap of the top of the shoe that causes some resistance too. So that's lumbricals, and that's especially useful for people who have flat feet, people who get plantar fasciitis. It's a condition of the arch of the foot. There you go. Okay, so Bridget's demonstrating plantar flexion again. So she's working the calves. It's a much easier exercise than when you're standing up, and especially for early rehabilitation. So we're just using a TheraBand, and it's basically a big elastic band. So there's different grades of it to make the exercise easier or harder. So that's quite easy, and she can incorporate speed with that too, so she'll go a little bit faster. That's it, so she's sort of flicking down. So it depends what sport you're rehabilitating for. You can bring in a lot of specific stuff with that. Alrighty, so a lot of ankle strains occur with this part of the ankle involved. The muscles that we want to strengthen go all the way up to the top of the lower part of the leg. So this is called an eversion exercise. So it brings in what they call the peroneal muscles, P-E-R-O-N-E-A-L muscles. Google it. And we're just doing that nice and slowly, so that when these muscles are strengthened, the chance of re-spraining are decreased. So again, she's doing it nice and slowly initially, and then later in the program you can add in some speed. So fast, that's it. And again, of course, that type of band can be upgraded to make it a more difficult one. Red's sort of low-medium strength. We don't want to overstress Bridget. Thank you all.
And then pulling that way.
That's it. So I forgot to mention the pillow between the knees with each of these, because generally what happens is your knee digs into the back of your calf, which makes it uncomfortable. So Bridget's now doing inversion. So that's the opposite to the everters. So she's bringing her foot up and in. You can see it describes sort of forming an arc up and out like that. That's it. So that's inversion, I-N-V-E-R-S-I-O-N. Beautiful.